Today's session was a very interesting one in the sense that resiliency was embraced by just about all of the panelists. Everyone said it is extraordinarily important for communities to be resilient and to get aid from the local government as well as the federal government. When they said that, I think the general feeling was that you wanted communities to be prepared for disasters so that they would somehow be in a position, if one occurred, they could show that they'd be able to recover more rapidly. The other aspect, I think, that was very important is that people recognized that it was very difficult for communities and for individuals to do the kinds of things we would like them to do. And there were reasons for that that several of the panelists gave. Denial being one. This is not going to happen to me. Or if it's going to happen, I won't be around when it does happen. And only after a disaster do people actually pay attention. So I think there was a feeling that even a disaster like Hurricane Sandy that has recently happened would be an opportunity for communities to do things in a different way. You could learn from other communities in the sense of those who survived very well after Sandy, those who might not have done well as thinking about what your own community could do. So I think there was an emphasis on the community, but at the same time there was a recognition that you had to have stakeholders at all levels playing a role. You had to have the federal government playing an appropriate role, as well as the local government, in terms of providing the kinds of incentives, information, and data. And I think knowledge base becomes very important. The area that I'm particularly interested in, and that we've been spending some time here in the afternoon session, is on risk management. There was a feeling that it was extremely important to present information in a way that people could understand. And often people don't understand or don't want to understand a very low probability event. If you can frame it in a way that people will pay attention. For example, if it turns out that you are dealing with a 1 in 100 year event, a return period of 1 in 100 years, or probability of 1 in 100, if you said that the chances of that event occurring would be greater than 1 in 5 of at least one of those floods or hurricanes, people might actually then find themselves in a position where they would pay attention. The other aspect that relates to at least something that I think came out of the report and that we feel is really important is how do you develop short-term incentives, ways that people, communities will pay attention to deal with their concerns in the short run and our tendency to be myopic, but at the same time think about long-term strategies. And one example that I'd like to just share as a part of this is the new flood insurance legislation that has been passed this past July, which extends the program for 5 years. In that legislation, they said that they would favor risk-based rates, the first time Congress has ever mentioned risk-based rates, to my knowledge. And when they mentioned risk-based rates, it would do a couple of things. It would let people know how hazardous the area is. It would also give an incentive for people to mitigate, to make their homes or properties safer, and because they could get a premium discount if it turns out that they had done this from their insurance premium. And if you couple a premium discount with a long-term loan, it might turn out that the cost of the loan, or it should turn out that the cost of the loan would actually be less than the premium reduction because this is a measure that is effective. So this is one way to think about a way to make a community and individuals in that community more resilient. You may need a building code to complement that, a well-enforced building code. So it's multiple strategies to deal with this problem, but also to frame it in such a way that people and communities will pay attention, figure out where the private sector and the public sector can work together to make both the nation and communities more resilient.